computer. Hi everybody. Welcome to our webinar today, Protecting Children from Junk Food Advertising. And thank you for joining us. My name is Melissa Ledger. I'm the Director of Cancer Prevention and Research at Cancer Council Western Australia. And we're just waiting, we know people are just joining us via the video conference. That can sometimes take a few minutes, so we won't launch into our official start just yet. But thank you very much, and it's a really exciting program we've got lined up for you today. So we're really thrilled that you've been able to join us. That's probably okay, 1 minute past 9, so we'll get started. And first I would like to acknowledge the traditional custodians of the land on which we're meeting today, and from where I'm presenting today, that's the Noongar Whadjuk people. And I'd like to pay my respects to traditional custodians on the lands where you might be joining us today as well. I'd like to offer my respect and acknowledge the elders past, present and emerging, and I'd like to offer acknowledgement to Aboriginal and Torres Strait Islander people that are joining us today. So as I said at the very beginning, this is a very exciting presentation that we have for you today. And one of the things I do want to just remind everybody, or just let everybody know really, is that we're asking people not to tweet today's results. They haven't been released yet. This really is a sneak peek, and so really as exciting as it is and as much as we want to share, please do not tweet anything that you see today on the video conference. So we're here to hear about the really exciting results and research from that will help strengthen policies in Western Australia to protect children from junk food marketing. And before we do though, I do just want to give you a bit of an overview on how this research has come about in Western Australia. So just a bit of background. In August 2019, Cancer Council formed a partnership with Telethon Kids Institute, and that was to establish what we call the Rapid Obesity Policy Translation. Now that is a mouthful, and we continue to muddle it all up, but it is a really important part of our work to have policy and research informing that policy work. We were successful in obtaining a grant from Healthway, which is Western Australia's Health Promotion Foundation. And without that funding, we would not be able to do the work that we've been able to do in the last 18 months. And it's enabled us to very quickly establish a program of policy-relevant research and advocacy efforts to build the case for change in WA. It has also helped support the priorities of other NGOs as well. We're working closely with non-government agencies such as these to ensure that we have a unified, strong and powerful voice when advocating for our priorities. And one of the things I failed to mention was that when we first applied for this partnership, or for this funding for our policy translation program, we did so with the Telethon Kids Institute. And they're a really important partner in this program, and you'll be hearing from certainly one of their researchers today, and we have many more things planned in the future. So not only are we working closely with them, but we're working closely with other partners, as you can see here, and other states and territories as well, so that we are all singing from the same song sheet and urging our governments to consider how to tackle the issues in their backyards as well. It's no secret that one of our priorities is restricting unhealthy food and drink marketing to children. The specific focus of our webinar today is looking at evidence that supports our joint position that calls for an immediate ban on advertising of junk food on all of our state-owned property, such as billboards, buses, trains and other assets. Government property, well, we think government property, should not be used as a mechanism for companies to boost sales for junk food, alcohol and unhealthy drinks, and our partners agree with us as well. And we know particularly that the costs associated with their consumption around not just social costs but also health costs. We know that 2/3 of WA adults and 1/4 of WA kids are classified as overweight and obese. And a report released in WA by the WA Department of Health this year estimates and predicts that costs to the WA hospital system alone will be upward of $610 million, don't get that wrong, $610 million a year by 2026. And we know that advertising works. Recent data from the World Cancer Research Fund showed that children's exposure to unhealthy advertising is directly linked to an increase in kilojoule consumption, which illustrates just how advertising influences food choices. The report also highlighted how countries around the world are failing to protect children from the effects of junk food marketing, and they believe this undermines every child's right to health and adequate nutrition. Restrictions on marketing junk food to kids is now recognised as urgent internationally. But I don't need to convince you. I'm sure that you have an interest in this area already. But what I do want to do today is arm you with even more evidence about why this is an important step for all governments, including ours. So we've got 3 speakers today, as you'll know, from the promotional materials you see, and they have each been commissioned under our Healthway funded project that I mentioned earlier. And that's so that we can add to the evidence around this issue. So our first 2 presentations will highlight the extent of exposure to junk food advertising around Perth schools. And the final presentation will critique similar policies implemented overseas and in Australia and describe industry arguments to our proposal. So first up, we have Dr. Gina Trapp. Gina is an NHMRC Early Career Research Fellow and Deputy Head of the Health Promotion and Education Research Team at the Telethon Kids Institute here in Perth. Gina's project, titled Junk-Filled Neighbourhoods, is officially being released next week. So today, as I mentioned, is just a sneak peek of the work that she's been doing. We're really excited to be the first to hear your results, Gina, and over to you.
Thanks, Melissa. Hi, everyone. It's so great to be part of this webinar today and showcase to you the results of our Rapid Obesity Policy Translation Research Project. Just bear with me a minute while I share my slides. Okay, so today I'm going to be showing you the results of our audit of outdoor food advertising near Perth schools. And as you can see from this bus shelter ad for Maltesers that we found just 21 metres from a Perth primary school, you'll want to sit down for this because the results are pretty shocking in terms of how pervasive unhealthy food advertising and alcohol advertising is around Perth schools. So the overall aim of our project was to describe, benchmark and quantify the volume and nature of all outdoor food advertising within a 500-metre radius of Perth schools. In terms of our methodology, we followed the International Informis Protocol, and in terms of school selection, we audited 64 Perth schools located across half of all Perth local government areas, which were selected at random within population density and socio-economic strata. Using GIS technology, we created navigation maps to spatially visualise the area within a 500-metre radial buffer around the school boundary. This area was then scanned on foot by our trained research staff for all outdoor advertisements, which were defined as stationary objects containing either a recognisable logo and/or an intended message. And the majority of our data collection occurred in the second half of last year. So our auditors worked in pairs and they used Samsung Galaxy tablets with an ODK Collect application to record and code each advertisement on site. We could store up to 5 photographs of each advertisement and record the geolocation of each ad, which we used to calculate the distance of the ad to the school boundary. Whilst we were on site, so standing in front of the advertisement, we coded it according to its size, so whether it was small, medium or large. We also coded it according to its type, so whether it was a billboard, a poster or banner, a freestanding advertisement, painted onto a wall or building, a digital or LED advertisement, or merchandising such as branded umbrellas, chairs and awnings. We also coded them according to their setting. So were they at or near a food shop, a non-food shop, along the road, on a building, on a bus shelter, or at a train station. We also, once we were back in the office, we coded each advertisement according to its content. So whether it was a food advertisement or a non-food advertisement. If it was a food advertisement, we further classified it according to the food that it contained. So whether it was advertising a core or a healthy food, which are foods recommended to meet daily nutritional requirements, and we had 11 subcategories of those. Whether it was advertising a non-core or unhealthy food, which is surplus to our daily requirements, and we had 15 subcategories. Whether it was a miscellaneous food, such as tea, coffee, or spices, and whether the advertisement didn't advertise a product as such, it just contained branding information only. So this just goes through the ineligible criteria for ads. So ads that we found that were not eligible included real estate or construction signage, on-premise signage that imparted information only, advertisements that were located inside stores, although we did include them if they were on the windows and visible from the street, or ads that contained just community or public information only. So I'd like to just take a moment and acknowledge our very large team of investigators, research staff, students and volunteers that helped make this rapid research possible. Some of whom I know are online listening today and finally get to see the results of all their hard work. I'd particularly like to acknowledge Dr. Paula Hooper for all her help with the GIS and the mapping, and Jolie Manzoufis, who did such an incredible job recruiting, training, supervising and coordinating this really large data collection effort, and Wesley Billingham, who's the statistician that analysed the results for today. So this slide shows you our school sample, and you can see that we had an even number of schools from high and low population density areas and high and low socioeconomic areas, and a mix of primary, secondary and K-12 schools. So this infograph shows you a summary of the top level findings from all schools combined. So we identified in total 5,636 advertisements, of which 30% were for food. And of those food advertisements, 74% were for unhealthy foods. And of those unhealthy food advertisements, 1 in 3 were for alcohol. Only 8% featured a healthy food product, 11% featured branding information only, and 6% were for miscellaneous foods. So the overwhelming majority of the food advertisements were for unhealthy foods. In fact, there were 9 times as many ads for unhealthy foods than there were for healthy foods. This slide shows you the most frequently advertised food products, and concerningly, alcohol was the most prevalent, with alcohol products featuring on 25% of all outdoor food advertisements, followed by fast food and sugar-sweetened beverages. This slide shows you the frequency of advertised food products that fell within our unhealthy or non-core food category. And excuse me, it shows you all 15 of the subcategories that made up this category. And I've bolded the top 5. So you can see alcohol was a clear front runner, followed by fast food meals, sugar-sweetened drinks, high-fat salt meals, ice cream and iced confection. This slide shows you the frequency of advertised food products that fell within our healthy or core food group category, and there were the 11 subcategories, and I've bolded the top 5. So low-fat meals were the most prevalent, such as soup, sandwiches, salads and sushi, followed by meat, fruits and vegetables, breads and rice products. This slide shows you the miscellaneous food category. The majority of these advertisements featured tea and coffee. This slide shows you the number of food subcategories that were depicted in each food ad, and you can see quite clearly the majority of food advertisements featured just one food subcategory. So 3 of the schools in our audit did not contain any outdoor advertisements of any kind, so no non-food, no food advertisements. These tended to be the schools that were in low population dense areas adjacent to sort of public open space and didn't have a shopping area present. 75% of schools did have at least one food advertisement, and of those that did, they had an average of 36 advertisements ranging all the way up to 190. 70% of schools had at least one unhealthy food advertisement, and of those that did, they had on average 28, ranging up to 136. Just over half of schools in our sample had an alcohol advertisement within that 500 metres, and those that did had on average 10, ranging up to 62. And only 37% of the schools in our audit had at least one healthy food ad, and of those that did, they had on average 6, ranging up to 19. This slide shows you the total number of advertisements within 500 metres of all schools by SES. And you can see that the schools that were located in the lower socioeconomic areas had slightly more non-food ads and food advertisements. We also found that schools that were located in the lower socioeconomic areas had a significantly higher ratio of unhealthy non-core food advertisements compared to healthy advertisements. We also found that schools located in lower socioeconomic areas had a significantly higher proportion of total food ads within close proximity, so within 200 metres. They also had a significantly higher proportion of unhealthy food ads within 250 metres and alcohol ads within 250 metres, but not healthy food ads. This slide shows you the total number of advertisements within 500 metres of all schools by population density. And you can see quite clearly that schools located in the higher population dense areas had significantly more non-food and food advertisements. But if you look at the proportion of food to non-food ads, it was actually higher in the lower population dense areas. But we didn't find any significant differences between the content of the food ads between the high and low population dense areas. This graph shows you the average number of outdoor advertisements within 500 metres by school type. And you can see quite clearly that the K-12 schools had nearly double the number of non-food and food advertisements. K-12 schools also had a significantly higher proportion of total food ads within closer proximity to the school. They had a higher proportion of healthy food ads and alcohol ads within 200 metres. This graph shows you the average count of outdoor advertisements within 500 metres by presence of a shopping area. And you can see quite clearly that if a school had a shopping area present within the 500 metre radius, they contain significantly more non-food and food advertisements. This slide shows you the average number of food advertisements by ad content and distance. And you can see quite clearly a big jump in the average number of outdoor food ads from 150 metres onwards. This graph shows you a count of total food advertisements within 500 metres by ad type. And you can see that the majority of the advertisements were posters or banners or freestanding signs. And this pattern of results was consistent across all school types, socioeconomic status and population density. But with the larger size signs, such as the digital signs and the billboards, 70% of those were advertising alcohol products. This slide shows you the size of outdoor food advertisements within 500 metres of all schools. And you can see that the majority of the outdoor food advertisements were small in size. Of these small ads, 75% were advertising an unhealthy food, the most frequent product being alcohol. For the medium-sized ads, 70% of them were advertising an unhealthy food product, the most frequent being alcohol. And for the large outdoor food advertisements, 66% of them were advertising an unhealthy food product, the most frequent again being alcohol. This slide shows you the count of total food ads within 500 metres by setting. And you can see that the majority of the food advertisements were located at or near a food shop, by the road, or on a non-food shop or business. We only came across one train station in our audit. It was a very small train station and we did not find any food advertisements there. We did come across in total 422 bus shelters, and 10% of those, so 44, did contain a food advertisement. But when we looked at the content of the bus shelter food advertisements, you can see that 60% of them contained advertisements for unhealthy non-core foods, the most frequent being fast food, sugar sweetened beverages, energy drinks and snack foods. 27% of the bus shelter ads for food were for alcohol and only 4% featured a healthy food product. So just to recap and summarise the key findings, we found that 74% of outdoor food advertising within 500 metres of Perth schools was for unhealthy food. We found that alcohol was the most frequently advertised food product, followed by fast food and sugar sweetened beverages. We found that there were 9 times as many ads for unhealthy foods than there were healthy foods. We found that the schools located in lower socioeconomic areas had a higher proportion of total food ads, unhealthy food ads and alcohol ads, but not healthy ads, within 200 metres. We also found that primary schools had on average 25 outdoor food advertisements, secondary schools had on average 22, and K-12 schools had on average 41, and a significantly higher proportion of total food ads, healthy food ads and alcohol food ads within 200 metres. 87% of food advertisements on bus shelters were for unhealthy non-core foods, including alcohol. And the majority of the food advertisements we found were located at a food shop or along the road. So what are the implications for policy and practice? Well, I think it shows that we need a comprehensive mix of strategies to reduce unhealthy food advertising near schools. And in terms of what could we possibly do? Well, we could look at revising national advertising industry codes to impose restrictions on the density type content of advertisements that surround schools. We could incorporate changes to the Department of Planning's guidelines for advertising on transport corridors to impose restrictions on unhealthy food or alcohol advertisements. We could create healthy food zones near schools and changes to land use and zoning policies to restrict unhealthy food and alcohol outlets near schools. We could make changes to local government, local planning policies to contain provisions relating to the guidance or regulation of food and alcohol advertising. And importantly, we could remove unhealthy food and alcohol advertising from all state-based assets, including billboards, digital LED signs and bus shelters, which we found from our research contained a high proportion of unhealthy food advertisements, including alcohol. So that brings me to the conclusion of my presentation today. Thank you all for listening. And if I don't get to your questions today, please don't hesitate to contact me or Cancer Council. And I'll finish sharing my slides now and hand back over to you, Melissa.
Thanks, Gina. Wow. That's an amazing presentation, really showing the problem that we have here in WA. And thank you for the solutions that you've offered at the end as well, really helpful. One of the things I failed to mention for those participants joining us is that we will be using the question and answer function on the webinar today. So please do start popping your questions in there. We probably won't have time to get to them all, but we will make sure we get to those that seem to have some common themes. So please do put them in there so we can see what are the questions most people are wanting an answer to today. So next, it gives me great pleasure to introduce our second speaker, and that's Dr. Zenobia Talati. Zenobia is a research fellow at the School of Psychology at Curtin University, and she's got a Bachelor of Psychology and honours in a Master's in Psychology and a PhD. Zenobia is a member of the WA Cancer Prevention Research Unit, so we see Zenobia quite frequently in our office because we work really closely with this unit, and it's lovely to see Zenobia presenting today on her work. Over to you, Zenobia.
Thanks. Can you hear me okay? Okay. All right, so I'll just share my screen as well. All right, so today I'm just going to talk a little bit about a study that we ran earlier this year, sort of a follow-up to Gina's study, much smaller, but trying to touch on some of the same things that she's looking at. So we were interested specifically at looking at the food and non-food advertising on certain bus stops and at the train station that high schoolers may encounter on their commute to high school. So just a bit of background quickly. In 2018, the WA government did begin phasing out alcohol advertising on buses and at train stations. So there is some precedent for removing and restricting certain types of ads. And a big argument for this was to do it for the children that would be exposed to these forms of outdoor advertising. The Queensland government have also introduced restrictions on junk food advertising on all government-owned assets and advertising spaces. And the ACT has had a ban on junk food advertising on all government-run buses since 2015. So this is something that is achievable, and we have seen support for it in different parts of Australia. Many reviews, including the WA Health Promotion Strategic Framework, the WA Health Preventative Health Summit Summary Report, and the Sustainable Health Review have all recommended that junk food ads should be removed from government assets. So there is momentum building for this, and with this kind of research, we hope to put out the message of why it's important to act on this now. So our study was done on the first day back at school this year, and we were interested in looking at a few schools, mostly large ones, but ones that varied in terms of their socioeconomic status. So we chose these 5 schools listed here, and we also threw in Bob Hawke College as that was newly opening this year, and we just thought it might be interesting to see what results we get from there. So we had 2 data collectors present at each of the bus stops at these high schools between 8 and 9 a.m. And we also had 2 data collectors present at the train station. So this is just a snapshot of some of the types of ads that food ads that our data collectors gathered. As you can see, there's the typical fast food and junk food ads that you've probably seen around on your commute. Okay, so now for some of the results. So firstly, we captured a total of 90 ads within that hour at the train station and on the buses. The majority of ads were for non-food products, so that's kind of a positive finding, suggesting that there's not a huge reliance on food revenue, advertising revenue in these places. But when we do look at the food ads, we found that the majority were for unhealthy products. So just quickly, when I talk about food ads, we were coding them based on things that included actual food products, retailers, restaurants, quick service restaurants, food delivery, and meal kits. And as you can see, quick service restaurants was a big portion of the advertising that we observed on that day. So in total, out of all just the food and drink ads, we found that 77% were for unhealthy foods. And when we look at just the drink ads, we also found that 77% were for unhealthy drinks. So that's not a very positive finding, but it is in line with what Gina's found and what we suspected we would find. When we look at the schools based on their socioeconomic status and the areas that they're located in, again, similar to Gina, we found that the lower socioeconomic schools had a higher proportion of unhealthy food ads. As you can see, that's indicated here in orange, much greater than what was found in the schools in the higher socioeconomic areas. Also interesting to note that the higher SES areas had a greater proportion of non-food ads. So there does seem to be some difference in the type of ads that are presented and observed by these students. Okay, so in conclusion, we found in this very small, brief snippet of a study that the majority of ads on buses and at the train station within the hour that high schoolers were commuting to these 5 schools in Perth were for unhealthy food and drink, and mainly a lot of this came from quick service restaurants. And it was interesting to note that this was also seen to a greater extent in the lower socioeconomic areas, or the ones with high socioeconomic disadvantage. This is a concern because children living in these areas in developing countries are actually at greater risk of developing overweight and obesity. So it is important to act to prevent them from being exposed to this, and we know that exposure to junk food advertising is a big risk factor for consuming these foods and then weight gain. So that's it for me today. The full report on this study is available at that link there, which I'm sure will be made available after this talk. Just want to thank the volunteers who helped gather the data. You would have seen pictures of most of them in Gina's slides. And if you have any questions, you can feel free to email me at my email address here. Thanks. And now I'll just start sharing screen.
Thanks, Zenobia. That was a really great little quick research project for that first day of school this year, and really helped us get some media attention for this issue. So really helpful to have that kind of research as well. So now I'd like to introduce our final speaker, and that's Dr. Catherine Backola. In fact, Associate Professor Catherine Backola. Apologies, Catherine. Catherine's from the Institute of Health Transformation at Deakin University. Catherine's a National Health No, she's not. She's a National Heart Foundation Future Leader Fellow and Associate Director of the Global Obesity Centre. Catherine is going to present research on the impact and feasibility of removing junk food advertising from state assets in WA. She'll also describe industry tactics, because it's fair to say that we passed the screen test on this one, which I probably shouldn't read directly from the page because it's got that a bit muddled up. But we know the work that Catherine's done is really important, and it's going to have a really big impact on what we do next. So over to you, Catherine.
Thanks, Melissa. And Catherine is absolutely fine. So my screen's fine there? Yep. Okay, so before I get started today, I just want to start with some acknowledgements and firstly to acknowledge the Cancer Council WA, and in particular Ainsley Satori and Kelly Kennington, who are involved in this piece or two pieces of work I'll present today, Healthway and the Telethon Kids Institute. And then really my team of people that I get to work with who have done a lot of the work behind this, and especially Alex up the top there, who's led a lot of this work. So you've heard a lot about the prevalence of unhealthy food advertising in WA, and so what I'm going to do in this talk is really place that into the international context and look at who's doing what are the barriers and facilitators around those different policies, and what's industry's response to those. So I'll present two pieces of work. They're both still works in progress. But the first is a scoping review. And the aim of this scoping review was to identify and synthesize all available evidence to support the implementation of policy to ban unhealthy food advertising on outdoor advertising spaces, public transport and government-owned assets. And when we collected our information and our literature, and we used 3 guiding research questions to synthesize it. And that was, where and how have policies been implemented that ban unhealthy food advertising on public assets or in outdoor spaces? What are the barriers and or facilitators to these policies? And what's the evidence both in terms of health and economic impact? So we conducted a really broad literature search across academic and grey literature. And then as I said, we got all that evidence, we put it together and we synthesised it across those 3 research questions, which I'll take you through now. So for the first research question, where and how have policies been implemented that ban unhealthy food advertising on public assets and or outdoor spaces? So the first lot of policies I want to draw your attention to are those policies where jurisdictions around the world have implemented a policy specifically to ban unhealthy food advertising on government-owned assets or in outdoor spaces. So in 2019, London brought in this policy to ban unhealthy food advertising on all transport for London assets as part of their broader London food strategy. Brazil has a policy in place banning unhealthy food advertising on Ministry of Health premises and its entities. And as Zenobia mentioned, the Australian Capital Territory from 2015 banned unhealthy food advertisements on its bus service, and in 2019 extended that to the light rail service. Amsterdam also has a policy to restrict unhealthy food advertising on billboards in its 50+ metro stations as part of its Healthy Weight program, but it is only advertising that's specifically directed to children. The next policy is the one in Chile, and this is a policy, one of the best broad brush policies in the world at the moment, that bans any kind of marketing, unhealthy food marketing that's directed to children. So that naturally includes public assets and outdoor spaces. Then we've got Finland, Quebec and Belgium, and whilst these jurisdictions don't ban specifically food advertising, they have a broad Consumer Protection Act which bans any kind of advertising directed to children. So it naturally also includes food. And then Ireland in 2017 came out with voluntary codes of practice led by government on non-broadcast mediums. A really impressive list, but they're voluntary codes. So we know that these are likely to be really ineffective. And then lastly, I'm not going to go into this one, but the rise and possibly fall of the Queensland policy on government-owned assets and government-owned premises, which came out in 2019, effective immediately, but to what we can tell, it hasn't really gone anywhere since. So I think the take home from that slide is really that quite a number of jurisdictions around the world doing things in this space, but there's a real opportunity for a much more comprehensive ban. No one's doing it really well, covering all the different types of outdoor advertising for unhealthy foods. and there's an opportunity for a country or jurisdiction to really step up and be world leaders in this space. So research question 2, what are the barriers and or facilitators to these kind of policies? In terms of barriers, most of the barriers were really driven around what industry is trying to portray, and that is the perception of a negative impact on revenue, the perception of an insufficient or inappropriate model for classifying foods as unhealthy. Certainly the possibility of legal challenges has been a concern of different jurisdictions, and these are all issues pushed by industry. Cross-border issues came up, so that's the inflow and outflow of marketing in bordering jurisdictions that don't have regulations in place. And the last one here in Chile, this issue around if you only restrict your advertising that's directed to children as opposed to the advertising that children are exposed to more so. It produces a grey area where industry really hangs on to this and starts to challenge what is directed to children and what isn't. In terms of the enablers, without doubt, you see this across all food policies, widespread support across relevant stakeholders, public health, NGOs, local authorities, and the public, really important. Strong political will and a political champion with power. So in London, there was a mayor. The mayor of London was a real powerful force behind this pushing that policy forward. But he also was the chair for the board of Transport for London, and this was the key implementing body that had to take the policy forward. In Chile, the president at the time was the ex-health minister and also trained in paediatrics, so a real health champion there. Effective partnerships really key, especially between implementing bodies. In London, there were 32 different boroughs, local level boroughs who had to implement this policy. There was the Greater London Authority, Transport for London. So these partners were key. And policy alignment, you saw earlier, all those policies were embedded in a wider strategy to either improve health or weight. So I think the sort of take home from this slide really is that industry is going to be a formidable force no matter what policy you put on the cards, and so you need to go in strong because there is evidence of watering down, and you really need to make sure you get your enablers lined up to make sure that we can start to counter industry. So the third research question was, what is the evidence for the health and economic impact of banning unhealthy food advertising? And we approach this question not in terms of direct evidence, because we know there's very little implementation of these kinds of policies worldwide, but what's the indirect evidence? And we broke this down across the impact on, or potential impact on advertising, food and health, and economic impacts. So in terms of advertising, we found 20 studies that really confirmed the prior two talks that you saw, that advertising exposures everywhere across different countries and in higher volumes in disadvantaged areas. So huge potential for these kinds of policies. In terms of advertising spend, an analysis of Quebec's ban on all commercial advertising directed to children showed that there was a reduction in fast food advertising of about $88 million per year. Impacts on diet, two studies specifically related to a significant association between food advertisement on public transport or outdoor spaces, on confectionery and snack consumption. But if you pair that up with the broader evidence that Melissa mentioned when she opened this webinar today around that, the relationship between food advertising and food consumption, then it's really quite compelling. And then lastly, the impact on revenue. If you Transport for London, this is the implementing body in London that saw their policy implemented and who accepts the advertising revenue. They released their annual report just last month, and there's been no change in, or in fact a slight increase in advertising income pre and post policy implementation. And the same in the ACT. If you look at the bus advertising revenue, it stayed steady across time pre and post policy implementation. So the last bit of the talk, I just want to touch on a second piece of work, and that is where we've gathered together all the industry responses, so both food industry and advertising responses to the proposal for the ACT policy back in 2015 and the London policy in 2018, and we've started to analyse these to look at the way in which industry is framing their responses to these proposals and the arguments they're putting forward. And I just want to draw your attention here to the ACT policy. So when this was proposed in 2015, the proposal was to ban unhealthy food and drink marketing on billboards and signage within places where the public gather. And we know that it ended up as a policy that really just restricted unhealthy advertising on buses and later the light rail network. So I'll take you through just some of the, just 4 of the key arguments that have come out so far and some counterpoints to those. The first is that food marketing is already regulated. We don't need any regulation. It's already self-regulated. We do it ourselves. And the counterpoint to this is that there's so many studies in the literature now and reviews of the literature that just shows that self-regulation in the marketing area and indeed more broadly across food policy, self-regulation doesn't work. And I think this study summed it up nicely when they concluded of this literature review that studies generally stress the ineffectiveness of existing self-regulation and the perils of surrendering the role of regulating food and beverage markets to the industry. And we see this in Australia as well. Wendy Watson's work and others has also shown that self-regulation of marketing and television has not had any impact at all. The next argument, and this comes through really strongly, whether it's the advertising industry or the food industry, is that parents should take responsibility for what their children eat. And there's 2 points to make on this. The first is that an overwhelming proportion of parents actually want policies and regulations put in place that help support them to make healthy choices for their kids. They don't want their kids pestering them for unhealthy foods because they've seen something on an outdoor billboard or around schools. They want action to help support them to make healthy choices. And the second point here is that when we talk about children, we're not just talking about young children, we're also talking about adolescents. And we know evidence shows that adolescents are more likely to seek rewarding activities. They're more likely they have their own purchasing power, so they're purchasing items themselves. They're more likely to be influenced by peers, and they have a stronger brand affinity when they see certain brands. So, these are adolescents who purchase their own food, and the literature shows that unhealthy food advertising increases food intake in this age group. Really common, no evidence that the policy will impact obesity, and we just need to look to tobacco control to see that no single policy will solve the complex issue of obesity. And we're world leaders in Australia in terms of tobacco control, but that took multiple actions over time to get our smoking rates to the rate that they are today. And the second point I think is quite important in that we really need to, when considering obesity, we need to consider what's our policy objective, and our policy objective should be to improve food intake, which then has flow-on effects to obesity. But what we really need to show is that our policy influences food intake, and that's our end point. Lastly, a negative impact on advertising income, and I've already shown you the evidence that came out of our review, but just for context, for the WA context, the Western Australian Public Transport Authority has reported that they receive approximately $1 million per year from all food and drink advertising. And if you consider that if a ban was put in place, a lot of this would be mopped up by other advertising, not to mention the huge costs of overweight, obesity, diet-related diseases far exceeds $1 million per year. So just to sum up, no jurisdiction around the world has implemented a comprehensive ban on advertising for unhealthy food and beverages in public spaces or on publicly owned assets. So there's a real opportunity for a jurisdiction to really step up and be world leaders in this space. Industry does pose a key barrier to the policy adoption, development and implementation. And so we really need strong coalitions, we need political champions, and we need to make sure there's alignment with existing policies. Our review showed that restricting unhealthy food advertising in public spaces and on public assets is likely to reduce exposure of that advertising, improve dietary intake over the long term, and have minimal financial impact on government revenue from that advertising. And lastly, just to end, Australia is a signatory to the UN Convention on the Rights of the Child, and so Australia does have an obligation to protect children from the economic exploitation and from the harmful impact of unhealthy food advertising. So thank you everyone for listening today, and I'll hand that back to Melissa.
Thanks so much, Catherine. Really compelling presentations here today, outlining the problem that we've got, and then looking at what solutions are trying to be implemented around the world. And I think that gives us really strong rationale for the work that we're doing here. So thank you so much to our three panellists. Really fantastic presentations, so informative. And we'll just wait for some more question and answers to come in, but while we do, I do have a couple already. I hope everyone has enjoyed it and everyone's been so busy watching that they haven't been typing in their questions, and I think that's probably what's happened. So we've got about 10 minutes, so let's start off with, we'll go to you first, Gina, and it was really just to see what plans you've got to build on this research that you've done for future research projects. Oh, hang on, we'll just unmute. We'll just have to get Gina.
Sorry about that. Well, what we'd love to do is look at a day in the life of a Perth child and examine the number and type of advertisements to which Perth children are exposed when using public transport or walking to school in Perth. So taking some hypothetical routes that children would take if they take the train to school, take the bus to school, or walk to school, and you know, examining the number and type of food advertisements that they're exposed to. And you know, it'd be great to combine that with, you know, how many unhealthy food ads are they exposed to from the minute they wake up in the morning to after they've come home from school, and you know, even on the TV and social media. You know, it really is everywhere. Oh, you're muted now, Melissa.
Please bear with us, everyone. You might have noticed this is our first attempt at a webinar, and we haven't quite managed to nail it yet. So I just had to quickly mouth unmute me. And of course, everyone can see all of our presenters as well at the moment. We haven't quite managed to figure out how to just see the one person at a time. So apologies for some of our technical naivety today. We do have another question here for Catherine, and it was really just to ask if you have found any evidence around self-regulation working. You know, is there industry proposals or evidence that self-regulation does work anywhere?
No, not really. So if you look at review after review, self-regulation just doesn't work at all, really. There might be some you know, slight reductions, but it's not meeting policy objectives by any means.
Thanks, Catherine, and probably the answer that we all expected, really, but thank you nonetheless. We have got a question here that I'll put to Catherine, to you again, if that's okay. And of course, our panellists, if you would like to add in an answer, please do just, you know, give us a sign, and we'll get you on, get you to unmute. So I'll just read it as it is. So that state-based assets are a large concern for kids, mainly Transperth buses and shelters. The question is, would a tax on unhealthy food advertisements, similar to a sugar tax, and a total ban on alcohol-based products be an option, potentially with extra ad revenue from this re-entering the disease prevention stream?
So in Australia, marketing is actually, there's tax cuts for different marketing. So companies actually can claim tax back for the marketing and that they do. So I think removing some of that is really important first and foremost. But it won't solve everything. We'll still see, you know, they have huge budgets. We'll still see this kind of advertising on everywhere we see it. So I think what we really need is if we want to get rid of it and we want to protect our children from unhealthy food advertising, we need to ban it. Anything else we do may have a small impact, but it will still be out there.
Thanks, Catherine. We've got another one that we're interested to hear, a really interesting angle, that if we just ban outdoor advertising, does that just mean industry will divert their budgets to other types of advertising channels?
Yeah, and we've seen this in tobacco. So the evidence is really clear in tobacco. If you focus on one medium, it'll just go to another medium. The advertising budget will go to another medium. So I think countries need to, and jurisdictions need to think about comprehensive approaches. There might be stepped approaches you can do along the way, and there's certain settings and mediums that you could potentially start with that might be a good place to start. But the reality is, we've seen it with TV through to, shift into digital, is that the advertising budgets will shift to other mediums, and these advertising agencies and food industry are really clever in how they try and push out their advertising.
Thanks, Catherine. It's interesting hearing these parallels with the tobacco industry, as you've mentioned a few times now, so very interesting. I've got one here for you, I think, Gina, but again, everyone's welcome to join in, and that is that the advertising industry has already said that they have the solution by adding, by not advertising near schools to their codes. So they've added that idea of not advertising near schools to their own voluntary codes. How can we counter that while stressing the amount of ads that are around schools?
Yeah, well, our studies certainly shown that outdoor advertising constitutes, a real frequent source of children's exposure to unhealthy food and beverage advertising around schools. So I think that's evidence that what the advertising industry are already doing just isn't enough, and that it justifies more government intervention to restrict unhealthy food advertising to children. The nature of outdoor advertising means that these messages can reach a really large unrestricted audience, and it's highly visible and continuously on. And as the outdoor media companies are fond of pointing out to potential advertisers, outdoor advertising is the only medium that you can't turn off, and as such the regulation of its content is particularly important.
Thanks, Gina. Look, lots and lots of people have said great presentations, and I will do a bit of a wrap up if everyone can stay with us for that, because I think it's important to acknowledge our panellists and the people behind the scenes here. But really great presentations and research. Zenobia, this one's for you, we think. And is there evidence of community support for policy change? Are you comfortable to answer that one?
Yeah. From a lot of the reading I've done in this area, and also just in tangentially related areas like support for healthy foods being made available at school canteens, for example, there is a lot of community support. I think when you're doing anything that concerns children, people are more likely to get on board with that, because maybe it's slightly easier because it's not themselves. Children are a vulnerable subset of the population. That's an age where a lot of habits and behaviours are formed. So yes, I think we really do have momentum to start doing this in areas where children are greatly exposed, and then those children become adults, and then we can maybe see some changes in the long term. But yeah, I think there is a lot of community support for this kind of thing.
Great, thanks Zenobia. I do want to thank our three panellists. We're just so grateful that you were able to join us today, and we're so pleased that we were able to support your research through our Rapid Obesity Policy Translation Unit and program here. So thank you once again for your efforts, and that really, as we've heard, that compelling evidence for action now in Western Australia. So I think the research really highlighted that we've got issues around advertising in disadvantaged areas, and we need to really step up around this issue of equity, that our most disadvantaged people are targeted more than those with advantage, and also that industry opposition seems to be one of the themes that came through today for me as well. So just really highlighting and bringing together some of the things that we knew, but it's good to hear it all in one place. Now, we've had some questions about whether this will be available on the website afterwards, and yes, we have been recording the webinar, so you'll be able to read it again. And of course, next week, some of the results will be available for you to read in reports, and papers I'm sure will be coming as well. And Zenobia's already shown that where you can access her report today. So we are ready. We are really ready. We've got a really clear picture of evidence of why, and we've got some answers as to how as well. So really ready to take on the challenge that's in front of us now. And I really like that Catherine's talking about someone needs to show some leadership and step up. And I think, you know, WA is pretty well placed, I think. So we're pretty excited. So, as I said, you'll be hearing more about this, so stay tuned next week. But I would like to thank not just our panellists, but our obesity prevention team here at Cancer Council Western Australia, so ably and aptly led by Kelly Kennington. This wouldn't happen without that leadership as well in public health, so really grateful to have her on board with this. And of course, Ainsley Satari is our coordinator for our Rapid Obesity Policy Translation Unit. It is still a mouthful. That hasn't changed from the beginning of the presentation, and we're delighted that she's able to wrangle all of this and really make some quick gains and translate that research into some really positive action, and that's the whole point of that unit and that Healthway funding. Mentioning Healthway, we are grateful and so lucky in Western Australia to have Healthway, the Health Promotion Foundation, that it's a legislative requirement that they support public health and health promotion and prevention programs like this, research and translating it into programs and being part of that evidence base. So we are so fortunate, and it's without them this wouldn't have been possible. Of course, some shameless self-promotion. Please follow us at Obesity Policy WA and sign up for our e-newsletter if you'd like to stay up to date with anything else in this area. It's new and it's exciting, and we've got lots to say, so please join us for those conversations on Twitter. And I think that with that, we will wrap up, and thank you so much for staying with us.